an important voice from the corporate side as well. Remember, concerns are mounting as the spread of this virus in India has risen to 71 cases reported so far. Viren Shetty, ED and Group COO of Narayana Health joins us right now to discuss a couple of things, including something that we're hearing about, the possibility of the government asking the private sector to help the government try and combat any rise in this. Viren, thanks so much for taking the time out. We'll come to the business case in a bit, but just wondering, have you guys as a body, not necessarily just Narayana Healthcare, but as the private sector healthcare body, received any kind of request or communication from the government talking about joining forces or helping out the government in case the situation worsens?
Yes, of course. We are in touch with the government, and we have been working with them very actively on the patients who currently are suspected of having this, as well as any sort of future sort of situation in which an outbreak could happen.
Okay, so I mean, are you saying that the government is, I would presume that the quantum of beds available for these treatments in just purely government hospitals would not be enough. Therefore, has there been some messaging done or some reaching out from the government to the private sector to try and keep some spaces quarantined in case the number of cases move up? Anything like that has happened?
See, one of the worst things that you can do when there are a large number of cases in this, in case there's an outbreak, and if 100 patients are there, if you spread them out 5 across 20 different hospitals, you're just spreading the disease. The fact is, a centralized location needs to be kept. They need to be quarantined and isolated in a single location, far away from the city, far away from everyone else, with the dedicated staff who are not treating other patients. It is very impractical to assume that every hospital with 2 or 3 isolation rooms, you can spread the patients out, because what will happen is those patients will then spread it out to the nurses and doctors who care for them, who then will in turn spread it to the patients who are coming in for other procedures like cancer or cardiac ailments, who are under a lot of medication, who are immune compromised. Those people are most at risk. So the worst place you can keep a patient with coronavirus is inside a busy hospital.
Okay, so you haven't heard anything to this effect, I would presume, right? We heard rumors of this, and which is why I thought it's best to get that clarity from you.
Yeah.
Okay. Just one more thing, because you guys would be at the top of all that's happening right now. The rise is starting to look a bit disconcerting, though albeit not at the same pace as we've seen some of the other places as well. Is it possible to even predict whether this would be at a faster clip, or is this looking like being a lot more contained than some of the other geographies, Viren?
Yeah, it's very easy to predict the spread of the virus. They've had enough data from the sort of cruise ship that was anchored off the coast of Japan. They have enough data on the spread of disease in other countries, and it follows your classic exponential J curve, which means it's 70 people now. It doubles every 5 to 7 days. Now, the only thing that we can do at this point is we cannot control it, but we can contain it. And so what we need to do is start enacting simple measures of isolation. All people should keep themselves at home. You should stop traveling. They have to stop going out into large crowded areas. Take it as a personal initiative until the government decides that they want to sort of enact large-scale sort of quarantines, the like that has happened across China, in New York, in Italy, and so on. That may happen sometime next week, but until then, it's very important for people to exercise personal initiative and isolate themselves in anticipation of the government doing something.
Right. Viren, good afternoon to you. Just one last question from my end. With regards to the number of tests that you would be conducting with regards to coronavirus, is there something that you are seeing or witnessing with regards to the number of people coming in to do these tests? And is there any kind of a mandate that only with certain kind of symptoms you're allowed to do the tests, and otherwise you home treat yourself?
Yeah, the testing is not done by us. All we can do is draw the sample. The tests are done at the National Institute of Virology in Pune. We just collect them if we have reason to suspect that these patients are infectious. In an ideal situation, of course, the testing kits will be given to all the hospitals and nursing homes and any lab that wants it. But in some cases, the government has decided that they will control the number of test kits that are given out there.
All right. So it's just this one lab that we're talking about, and is there a hospital like yourself, if you want to get these testing kits and have these tests done at your end, is that a possibility? Because for all the samples to be collected and then sent to one location, it's also time consuming.
Yeah. It's not yet an option. The government has not allowed it.
Okay. Viren, thank you so much. Appreciate you taking the time out and giving us some of this clarity. Thank you so much for your time today.
Great. Thank you.